Markowitz, and I am the last physician trained by Dr. Selikoff at Mount Sinai in the mid-1980s. Suppose I were to tell you that we had a new medication that, taken once a year, one time once a year, could allow the early detection of the most common lethal cancer in the United States, and that such a medication exists, and it would be available for you to take, and it could essentially allow early detection and cure of the most common cancer in the United States. You would, I think, celebrate this. I think it would be front page of Mr. McCumber's Montana Standard. The pharmaceutical company that made it would broadly advertise. We'd get pop-ups on our email and the like announcing this medication. And there'd be public campaigns to promote the use of this medication so that we could address this major cause of cancer and prevent people from dying from the cancer. Well, we have no medication like that, but we have something very similar to it, which is low-dose CT scanning for lung cancer, early lung cancer detection and cure. And what I want to do in the next 15 minutes is convince you why you should take your turn in promoting this use among your friends, your family, your coworkers, and the like. My first experience with lung cancer was when I was a medical student. I had a patient, a third-year medical student, a patient named Peter. That's not his real name, but Peter. And Peter owned a restaurant in New York City called Phoebe's down in the Bowery, which everybody knew. And Peter presented with, he was light-skinned, and his presentation when he became ill was his whole head became engorged with blood, and both his arms were engorged so that it was red, it was swollen, and he was distinctly uncomfortable. And it turned out that he had lung cancer. He had a particular presentation of lung cancer, which is called superior vena cava syndrome. His tumor was pressing on the vein that allowed the return of the blood from his head and his arms to the heart so that it wasn't returning properly, and he was getting this really awful swelling of his head and upper extremities. Well, Peter got radiation therapy. That was advanced lung cancer. They couldn't do surgery, and he died a few months later. And I learned that actually was typical for lung cancer. Not everybody presented with the superior vena cava syndrome, but 90% of people who came in with lung cancer had advanced disease, and there was very little that Dr. Flores or the surgeons could do about it, and most of them died within a year or two. So a few years later, I was a resident at Mount Sinai, and our favorite professor, Dr. Frank and others, our favorite professor was actually not Dr. Selikoff. It was Dr. Lillis. And Ruth Lillis taught us how to read films, to read asbestosis and pleural disease on chest x-rays. And Dr. Lillis was tough. When you presented a case to Dr. Lillis, what you did your homework first. You'd go into her with a couple of questions. Well, you'd have to do your homework because she would get the first 10 questions, and then you'd be able to ask your questions. One thing I learned about Dr. Lillis, and she taught us to read films, only a few years later, she never told me this, that she had been diagnosed with lung cancer. She had gone to a conference in Eastern Europe. She had fallen, she had hit her chest, an x-ray was done to see whether she had broken a rib. She had not broken a rib, and she was reassured, but she said, let me take a look at that film. And she looked at the film, and she said, yes, the rib is not broken, but what is that lesion? What is that mass behind it? And sure enough, there was a faint nodule, which was pathologic, and it ended up being a lung cancer, and it was removed surgically, and she was cured. That's early stage lung cancer. And before the days of CT scan, of the use of CT for screening, we only accidentally detected a lung cancer at an early stage when it could be cured. So here's just a picture of how common lung cancer is compared to the next 4 most common types of cancer in both sexes. And I'm thankful to Dr. Frank, Dr. Lemon for noting that lung cancer is more common among asbestos exposed than mesothelioma is. So while I was learning this about Dr. Lillis and really speculating about how we might make an advance in this, actually there were some physicians down the road at Cornell, Dr. Claudia Henschke, Dr. David Yankelevitz, who were starting to use low-dose CT scan, low-dose radiation for the early detection of lung cancer. And this was the early 1990s, And in 1999, they published their study in Lancet. 1,000 people, they detected 3% had lung cancer. And the most important thing is that 85% of the people they detected had early stage disease, just like Dr. Lillis, whereby they could undergo surgery and be cured. At the time, I was running a medical screening program for nuclear weapons workers around the country. And nuclear weapons workers built our bombs. They were exposed to radiation, asbestos, and many other lung carcinogens. And we decided in July 1999, when Dr. Henschke and the Untitled published their report, a month later, we proposed to the Department of Energy that we include low-dose CT scanning in our program. And this is in the year 2000, the opening of our CT scanner, and this is in Paducah, Kentucky. And you can see certain luminaries there, including Senator Mitch McConnell, which is in part how we got our support. And to his right, David Michaels, just recently retired Assistant Secretary in charge of OSHA. And I just want to point out, for those of you who know these people, this is the only time you'll see David Michaels to the right of Mitch McConnell. And I should say on the left that's me. That's how long I've been working on this issue. And this is our current CT scanner in Oak Ridge, Tennessee, parked at the Union Hall, because that's the way we get people to come in. They get to accept. This is what this union is doing for people in Oak Ridge, Tennessee. And this is our scanner. So we have now, since 2000, scanned over 13,500 people. And we have detected 151 lung cancers, meaning about 10 cancers. For 150 people who have come through our program, 1 out of every 89, we have detected lung cancer in. But what's much more important is that 2/3 of them have early stage disease. So they have stage 1, most of them, or they have stage 2, and they can go see the equivalent of Dr. Flores in Knoxville, Tennessee, have their surgery, and be cured from their lung cancer. And then moving forward from our work, from Dr. Henschke's work, and the National Cancer Institute published a study proving that lung cancer screening could reduce lung cancer mortality, which was what was needed for the world to accept that this was an acceptable screening method. And so now, over the last 2 years, Medicare and private insurance under the Affordable Care Act has to pay for early lung cancer detection through low-dose CT among a certain group, smokers who are age 55 and over. They don't mention asbestos. That's our work, to spread the word among people exposed to asbestos, because they don't address or acknowledge that asbestos is a risk factor for lung cancer. So now I want to spend the last few minutes I have discussing what you can do. Because frankly, we doctors have done our job. We have demonstrated that this method works. But now it's up to people to take this forward and to tell your family, your friends, your coworkers. In my next 1 minute, I'm going to teach you how to convince your brother Bob that he should have a CT scan if he's at high risk for lung cancer. So let me explain. This is what a normal CT scan looks like. A slice of the lung. On the two sides, the blackened areas are lungs. You see no lung cancer here. On the other hand, this is what someone with advanced lung cancer looks like. On the right side, obviously, lung almost completely occupied by tumor tissue. As opposed to an early detected lung cancer, where you can see the mass on the left, right? But you can see it's small and it's surgically removable. So that's the difference between late lung cancer and early lung cancer. So these are the excuses that your brother Bob is going to give to you for not going off for a low-dose CT scan. And the most important excuse is that I don't want to know. I am scared because they might find lung cancer. And this is a misperception. You need to convince him that the lung cancer they might find on low-dose CT is not the cancer on the left, the advanced cancer, but it's the cancer on the right. It's the early cancer that can be detected and surgically cured. Some people think cancer won't get me. Well, it does get 150,000 people per year. It's the #1 cause of cancer. Some people think there is a cure for lung cancer. Not so, unless it's detected early. Some people say, I'm too busy, I don't have a doctor. Well, you can help them with that. If they don't have the money, you can assist them. And some people are very fatalistic. I will still die from lung cancer. And the fact is they won't if it's detected early. 90% of people with early disease who are detected and it's surgically removed, they will lead a good life. And then the final excuse is nobody told me, which is your job because you can tell them. So thank you very much, and I guess it's your turn.